Hi, my name is Dr. Branzik and my practice is Smile Ranch Dentistry. I am in Heath, Texas. I'm a biological dentist and we are discussing today safe amalgam removal, and I am showing you what the protocols that we have in our practice to protect our patients and ourselves when we remove mercury fillings. Amalgam fillings are comprised of around 50% mercury, and mercury is the most toxic non-radioactive element in the world. So, to start, we use nitrile gloves and a nitrile rubber dam. And the reason why we use nitrile is because latex, the mercury will seep through latex and leach out into the patient's oral cavity and will be absorbed through the transmucosal gums and soft tissue. So we use nitrile, and we also make sure that whenever we're taking care of our patients, they're on 100% medical grade positive pressure oxygen. And we also use a nitrile rubber dam in the patient's mouth to isolate the tooth that we are excavating the mercury on. Underneath the rubber dam, we use an isolite. This is an isolite, and the isolite is beautiful because it acts as a bite block. It also retracts the soft tissue out of the way so it protects the patient. It suctions saliva and any debris, and it also illuminates the working area at the same time. So we use both an isolite and a rubber dam. We also use a cleanup tip, and this is connected to the high evacuation or high suction, and we actually place this on the tooth that we're working on, which suctions out the mercury as we remove it. In addition to that, we use an external vacuum, which will help remove the excess mercury vapor that's in the air. And above that, we also use an ionizer, and so these are ionizing plates for any excess particles that are in the room, and we can actually wipe that, and there are mercury particles, so above everything else we still take extra precautions. Now, that is for the patient. What we do for ourselves is we are draped in a full gown. We also use a drape over our head, a hood on our head, and we also use a respirator so that we're not inhaling the mercury vapors. The mercury vapors that are in the air, whenever we're removing them, 80% of those go into our lungs and 30% of the mercury will go into our bloodstream. So we take everything very seriously. Whenever the mercury is taken up into the suction, it is removed with an amalgam separator that is in the back of our office, and all of the vapors go to the outside of the office so that whenever people come into our office, they're not exposed to high levels of mercury. This is not true for most dental offices. And whenever we remove the mercury, we put it in a drum.